Hey guys, Dr. Stu Katzen here, Coach E at CrossFit Mainline. Today we want to talk about, I had a patient come in the other day from one of the athletes, and this morning we just did some running, and they did couple days ago some toe to bars. What do those two things have in common? Hip flexion. So sometimes people come in complaining of some lower abdominal discomfort, sometimes also combined with some low back pain. What do those have in common? The common muscle for hip flexion is the psoas muscle. Psoas muscle is unique because not only is it a major hip flexor, it also inserts to the spine, and it's a unique muscle because it also inserts to the discs of the back. So if it's a contracted psoas, it can mirror back pain, also abdominal discomfort. So two ways we try to work this out chiropractically. Well, first is with mobility. One is my favorite is a psoas smash with a little cross ball. You just want to come lateral to the umbilicus and work your way up and down. And I'm going to have Coach Eve demonstrate how we do this. And then I'm going to show you how I release this. As a chiropractor, we can do some active release into that muscle, which really allows it to relax. So Coach Eve is going to show you how we do with the lacrosse ball. You can do it standing. If it's very tender, you can push it in with two hands and just really work it in. But as you advance it further, the best way to do it is put some weight onto it. You can offset with your hand. If it's too tender, you can use your hand to offset or to the opposite hip. And Coach Eve is going to work it in right in the psoas muscle, which is again lateral to the umbilicus and up and down, up to the hip, up to the abdomen. Work it in. You feel that?
Yep, I feel it.
So you work that in. About anyway 3 to 5 minutes to work that in. I'm also going to have a roller over just so I can show you briefly we would assess this chiropractic. I'll do this side so you guys can see. So the psoas muscle is, I come lateral to the umbilicus. You can feel right up in here. And then sometimes it's a little tender, it's knotty. You can see when it looks for her face, it is tender. So what I have her do is I have her take a deep breath in, and I have her hover her foot off the ground and try to extend the foot straight. And I'm just demonstrating, but I would be applying pressure here and then bring it back up again. And now breathe out. And then I'll do a couple passes to work my way down. You feel that right there? It's really ropey. So I put a pressure in there, and we have her stretch it out, and then bring it back in. And we do a couple passes of that. And then traditionally, I'll also check out their lumbar spine. A lot of times there's a misalignment down there. So by realigning that low back, take pressure off the nerve that innervates that area, take tension off that psoas muscle. So if you have any low back issues, any abdominal issues, come in the office, we'll do an assessment here, we'll check you out. Make sure you warm up before your workouts, and we'll see you next time.